Hi, it's Dr. David Greene, founder and CEO of R3 Stem Cell, the global leader in regenerative therapies. Today the topic is what you need to know about stem cell therapy in Nepal. I'm going to cover what makes international stem cell procedures different, what kind of biologics are used, where do they come from and how do they work, will stem cells actually cure my condition, do the number of stem cells matter for treatment, what kind of outcome can I expect and for how long, what are the risks and side effects, and how do we come up with our pricing, and are there any extra fees? So I created R3 Stem Cell 12 years ago when I was a student in the executive MBA program at Arizona State. I actually created it as a fake company for a class project. And then my professors throughout the university loved the idea. So here we are, 12 years later. We've won tons of awards. We've done over 23,000 stem cell procedures. We're in 6 countries: India, Pakistan, Philippines, United States, Mexico, and South Africa. For Nepal patients, we do those procedures in India. You don't even need a visa to come to India. And we're right in Delhi, close to the airport. So it's hour and a half away. We treat over 70 conditions. We've never had a significant adverse event around the world, and we continually are on the cutting edge of regenerative cellular technology. So we know there's a lot to consider. Even though we've been around for a dozen years, it still represents, new technology around the world. It's key for patient education to be accurate to help you make appropriate healthcare decisions. We have a lot of competitors who disseminate misinformation to hopefully benefit them, and that's a shame. You deserve accurate information so you can make good decisions. What makes stem cell therapy different internationally than it does, say, in the United States, where we started and where our headquarters are? Well, there is no FDA, U.S. FDA, outside of the United States. That's good in one sense, that typically things are less restrictive, but there is no more strict regulatory agency in the world than the U.S. FDA. Their budget is $8-9 billion a year. So we follow those regulations, and we still have, the highest quality around the world. We can culture stem cells outside of the United States, which makes them more cost effective, and that's how we've been able to bring the cost down significantly. There are certain types of application of the stem cells we can do outside the United States, but not inside the United States. Pricing outside the U.S. may be lower, like for instance with us, and it may be higher. We have some competitors in Colombia, Panama, China, who are 2 to 3 times what we charge. I don't know why. Here's an example of one of our clinics in Mexico. Dr. San Miguel is doing an intrathecal procedure into a gentleman's back who has a spinal cord injury. We do those procedures. They're very safe. We've done them over 1,000 times, around the world. But the FDA in the U.S. just doesn't like that. So we don't do it there. But it's the best way of getting stem cells to the central nervous system and the spinal cord to get the best outcomes. What kind of biologics are used? We use what's called birth tissue, and we obtain it after a scheduled C-section. And this could be for the placenta, it can be for the umbilical cord, the amniotic fluid, the umbilical cord blood, and normally this tissue is discarded after birth. But in this case, the donors are consented, they're screened, and the tissue is obtained. There's no harm to the baby or the mother. We use the umbilical cord tissue, the Wharton's jelly part of it, I'll show you in a second. We also obtain exosomes. This is donor tissue called allogeneic. It does not cause a rejection when it's used in a non-related, recipient. And it has an incredible amount of mesenchymal stem cells, growth factors, cytokines. Here is a cross-section of an umbilical cord. You can see that it has 2 blood vessels, arteries, and a vein. We do get the umbilical cord blood and then we remove the red blood cells, and it's a great source of stem cells and everything. And then we remove those, and then we use the flesh-colored tissue called Wharton's jelly to give us an incredible amount of stem cells, exosomes, growth factors. We can culture those stem cells in our clean rooms. We have 2 labs, one in the United States and then one in Pakistan. We keep the culturing to the 3rd generation, the 3rd passage or less, to make sure they're very potent and pure and viable. We don't use DMSO preservative, so there's no sulfa. We use glycerol, which is a benign preservative. Our labs are FDA registered and ISO certified. We follow the highest standards in the world, which is CGMP compliance. Here's our FDA registration. We update it every year. The one for 2024 just came in, but basically we register with the FDA and they come out annually and they audit our organization. Okay. Here's the example of why we don't use your own tissue, your own bone marrow. And it's on this graph format. When you're born, 1 in 10,000 stem cells in your bone marrow, 1 in 10,000 cells in your bone marrow is a stem cell. As we age, look at the age of 50. That drops by a factor of 40, so that you have 40 less times stem cells in your bone marrow. And by the age of 60, that goes down to by a factor of 200. So at that point, it's a needle in a haystack. It doesn't make any sense to use those. Basically, you're just getting glorified blood out of the bone marrow. So we haven't done that in 7 or 8 years. We do use a lot of exosomes along with our stem cells. You can see in the top right cell, they're creating exosomes. They're encapsulated in bubbles inside the cells. And then as they get released into the extracellular space, you can see, for example, here is an exosome that is then going to attach to a recipient cell, and then it will release all of the elements of the exosome, such as growth factors, cytokines, mRNA, peptides, and they will then help sick cells repair themselves. So it's been a very effective assistance to stem cells to help repair and regenerate damaged tissue. Here is a cartoon of why these exosomes are so effective. So back at Stanford University in 2005, they did an amazing experiment, and they used a technique called parabiosis, where they connected an old mouse to a young mouse so that they shared the same blood supply. The circulation went between them. And what they did was they gave the old mouse a skeletal muscle injury, and then with the circulation from the young mouse, it healed very, very well. But if they didn't do that, it didn't heal well at all, as you would expect in an old mouse. So the question is, why did it do that? What is it about the blood flow from the young mouse? So they tested to see if it was the stem cells. In a second experiment, it was not. Then, over the last almost 20 years, they've done more and more experiments looking at this same, parabiosis experiment for heart injury, stroke, kidney stuff in the mice, and it heals it every time. So the question remains as to what is it from the young mouse, and the current theory for the last 2 decades has been the exosomes. So exosomes are now looked at as the fountain of youth, and we've been using them for years in conjunction with stem cells. We call it the 1-2 punch. So the exosomes work a little bit faster than stem cells. They give faster results, and then they wear off faster. But if you look at the umbilical cord stem cells, they tend to work a little bit slower, and they have a more sustained effect. So that's why we use them together. If you look at this chart here, what we did was we tested our stem cells after thawing them out right before use to see what is the viability that we're seeing. Now, it's very, very, very high. It's 96% of our cells are viable. And that's great. I mean, we have a lot of competitors who will, without any evidence, say, oh, they don't use any live cells, the stem cells are dead, so on and so forth. And as you can see here, that's absolutely not true. And this test was done, last week. So where do the biologics come from? I mentioned that they come from birth tissue. It's specifically from consenting donors after a scheduled C-section. And because it's scheduled, we're able to screen the donors, we're able to consent them. We get a very high yield because it's a controlled setting, and it's more sterile than it would be if it was a vaginal birth. Here's an example of the testing that we do on our biologics to make sure they're safe to use. The FDA requires this. We test for CMV, hepatitis, HIV, syphilis, West Nile virus. We also culture the cells to make sure there's no bacteria, and we look for endotoxin as well. Only if all that is negative will our medical director sign off for the biologics to be used clinically. Now, key points. Our safety is around the world equitable to U.S. FDA standards, which are the highest anywhere. So it's a non-factor when we use stem cells in these other countries. Our lab and facilities are FDA registered. We abide by the highest quality assurance standards anywhere in the world. We have free sale certificates to export to any of the countries that we do treatments in. One of the questions we get all the time is, will I possibly see a rejection of the stem cells? And the answer is no. The umbilical cord stem cells are immunologically privileged. They don't have MHC2 markers, so they do not cause a rejection reaction. And the exosomes don't either. Exosomes are actually not cells. They are byproducts of cells that are seen all throughout the body. We use the ones that are byproducts of umbilical cord stem cells, and they don't cause a rejection reaction at all. Another question we get is, well, I'm getting a stem cell therapy. Could I possibly get a tumor as a result of that? Well, this is just one study out of like 12 that have been done over the years showing that no animal or humans that have received Wharton's jelly stem cells have shown formation of tumors or cancer or exacerbation of cancer. It just doesn't happen. Human embryonic stem cells, which come from aborted fetuses, can absolutely lead to tumors. They also get rejected right away, but we don't use those. We never have. Will stem cells be a cure to my condition? No, they won't. A lot of people come to us and they say, well, I was told by this other clinic that I get stem cells and I would be cured. Well, that is not how it works. It may be if you have a leukemia or some kind of a cancer where you get a bone marrow transplant. That's a whole different type of treatment. But for what we're doing, for kidney, heart, liver, autism, things like that, it's not a cure. So be wary if anybody tells you that it will do that. We use the term mitigation because, for instance, if somebody has really bad kidney failure and they want to avoid dialysis, we can typically help them do that, but it's not going to completely cure the kidney. You're probably going to need a treatment every year or so. With our biologics, we created the Intella Cell, which is the smartest stem cell in existence. And these are where we specifically select the mesenchymal stem cells that have no mutation. They are very pure. They are potent. They have high viability. They have a lot of colony-forming units, which means they're extremely active. And we don't culture them past the third passage, so they're extremely potent as well. So how do they work in the body? Well, the first thing they do is they seek out inflammation. All of chronic disease in the body has a significant amount of inflammation, so these stem cells will go there and deposit themselves and go to work where they are needed. They do have the capability to turn into many different cell types, so that's excellent. They're very persuasive, along with exosomes. They're active in cell-to-cell signaling to turn on repair processes to help fix, sick cells. They help promote the processes we want them to promote. So, for example, if you have an autoimmune disease, these stem cells can help shut down the part where the body's fighting against itself. But it's not going to shut down the rest of the immune system like a steroid would. It's going to help amp up the rest of the immune system so you get a better immune response. So it's very selective, all right? Now, the Intella cells are also able to shut off with their replication. They do not cause tumors. like an embryonic stem cell would. So that's one of the additional benefits. So do the number of stem cells matter for the treatment that you get? They absolutely matter. There's been a lot of clinical trials over the years showing that more stem cells is better the vast majority of the time. We will utilize either 1 up to 5 million stem cells per kilogram, depending on the condition being treated, and as well as the severity of that condition. So our educated guess over the years is that anything more than 100 million stem cells per procedure day is ill-advised. And the reason is we don't know how many stem cells you can actually use in one setting. But we have educated guesses that it's about 100 million. So if a patient needs more than 100 million, we'll just break it up into 2 days or 3 days if necessary. So when it comes to the conditions that we successfully treat, there are over 70. So if you look at the different condition categories, autism spectrum disorder, cerebral palsy, fantastic results with those. Neurodegenerative, such as stroke, MS, ALS, orthopedic, whether it's hip, knee, whatever joints you're dealing with, low back or neck, the results are fantastic. Pulmonary diseases such as COPD, pulmonary fibrosis, post-COVID, emphysema, we've seen incredible results. We've gotten a lot of patients off of oxygen. Autoimmune conditions such as diabetes, Crohn's disease, IBD, Hashimoto's, it's a pretty lengthy list that does well. Urologic, specifically erectile dysfunction, we have about a 90% success with. Diabetes, as I mentioned, type 1 or type 2. Ophthalmologic, such as macular degeneration or retinitis pigmentosa. And then kidney, heart, and liver failure respond well. All right, so here's a picture of the entrance to our R3 India clinic, where the patients from Nepal come. It's very contemporary, it's very comfortable. Our doctors and staff are extremely compassionate and just very nice people. You'll have great conversations while you're there. We do a lot of aesthetic treatments too. We have laser machines, hydrofacial, so you're welcome to receive those as well as the stem cell therapies. Our biologics are all labeled so that they're trackable down to the donor. And we also use PRP, which you see on the right side there, the straw colored. That's where we take some of your blood and we spin it to concentrate the growth factors and platelets. We frequently use the exosomes, the stem cells, and the PRP together. So what kind of outcome can you expect from the treatment? Well, that's a pretty loaded question. For arthritis, most patients get anywhere from 1 to 4 years of relief. We have a very high patient satisfaction overall, 85% at 1 year outcome. And when you start looking at kidney, heart, liver, most patients are going to need a repeat treatment once a year. But it's a lot better than either going on dialysis or a transplant list. And because patients are going to need it about once a year, it's very important to be cost effective. And you're not going to find a more affordable stem cell clinic than where we come in. And if you do, let us know. If it's an apples to apples comparison, we'll match it. So what are the risks? Well, these have been very safe procedures for us. We've never had a rejection reaction. We've never had a disease transmission or a deep infection. Usually what we see is maybe a low-grade fever, maybe some dizziness or lightheadedness, possibly some chills or nausea, and these usually resolve within about 12 to 24 hours. So why should you consider R3 stem cell for your regenerative care? Well, our outcomes are second to none, 85% overall. Over a third of our procedures come from referrals. I think there's nothing better as a compliment than to get referrals from existing patients who've done very well. We do include a VIP escort from the airport, hotel to the clinic and back, so you don't need to worry about ground transportation. This is, as you saw the entrance, it's very contemporary. It's a comfortable medical clinic. It's very protected. We have CCTVs and whatnot, and our experience. We have over 20 customized options for patients, 23,000 procedures in the last decade. We'll do price matching if necessary. We want to help the most people as possible with the highest quality stem cells you can think of with the Intella Cell. Experience matters. We've been in the U.S. for 12 years. We've been international for about 6 now. We've developed, like I said, over 20 customized protocols. We are the most trusted worldwide provider of regenerative therapies. Unparalleled quality assurance. Patients are welcome to look at our certificate of analysis, FDA registration, ISO certification, whatever it takes to make you feel comfortable that you're getting a quality, safe, regenerative therapy. Once again, here's our proof of product. So we have viability on the left at 96% after thawing it out, ready for use. And then on the right, when people get exosomes, we are the most concentrated product available. On the bottom right, you can see with the arrow, we have 25 billion verified exosomes per cc. Nobody else has such a concentrated product to produce such a very, very good outcome for you. We have a research team that continually puts out papers. Here's one on autism spectrum disorder with stem cells. Here's one on premature ovarian failure. Here's one on cerebral palsy. We have others being published on kidney disease, diabetic kidney disease, things like that. So our goal with pricing was to put together the Mercedes of stem cell treatment for the pricing of a Ford. Because of our economy of scale and the fact that we do so many procedures worldwide, that's exactly what we've been able to do. We want to make effective stem cell therapy available to virtually everyone who needs it and can benefit. We only have a few extra fees, such as for the conscious sedation, usually in children, the intrathecal administration for our anesthesiologist, and then if there's extra days at the clinic, but they're nominal. R3 Stem Cell India, our clinic is in New Delhi. It starts with a free phone consultation. If you just contact us, we'll get you set up for that. Our patient concierge representatives will assist you with all the travel logistics, travel from the airport to the clinic and back. You don't need a visa from Nepal, so don't worry about that. And we talked about the advantages of getting your treatment done with us. The outcomes are unparalleled. The safety is unparalleled. Our cell counts are very, very high and viable and active. We have the Intella Cell, which is the smartest stem cell in the world, and then our pricing. So for the last dozen years, we've been featured all over the place. I present routinely, internationally at research conferences. So you'll be in very good hands. Give us a call today. There's the number. Visit us online at r3stemcell.com/Nepal, and we'll get you squared away with that free consultation. Thank you for watching, everybody.